Hi, everybody. It's Dr. Patricia Coughlin here. I wanted to talk to you today about the vital importance of working in the transference. You know, we focus an awful lot, especially in ISTDP, on the triangle of conflict, but really working that triangle of person is also of paramount importance. We know, again, that the best therapists are really experts at spotting patterns. And the most important pattern to spot is the patient's conflict alive in the relationship with you. So research shows that working in the transference, particularly interpretations in the transference, right? In other words, you're reacting to me as if I'm your mother, tend to be a little bit dicey, especially with healthier patients, actually. There's research to suggest that making those kinds of interpretations is actually associated with poor outcome. But conversely, patients with character disorders, who, again, these days are about 80% of our patient population, it's actually crucial that you do spot the same pattern alive with you. This gives you the opportunity to rework that conflict in the here and now. And that's the other thing that research has really been revealing, that working in the here and now, what might be called immediacy, what's happening in this moment, is especially impactful. So there are really two ways to work in the transference and two kind of sets of behaviors that you're going to be looking for. The first is what Davenlu called the transference pattern of behavior. This is akin to Paul Wachtel's cyclical psychodynamics, or Weiss's idea about how the patient will unconsciously test you. It really has to do with their characteristic way of relating. So it might be a pattern of passivity, sitting themselves down in the chair and looking at you, waiting for you to take over. And these are the people who, of course, complain that everyone's walking all over them. And as I often say, well, you know, the fact that you're lying down makes that a whole lot easier. So you can complain that people are walking on you, or you can decide to stand up. So really being able to elucidate these interpersonal patterns that get the patient in trouble. Again, research shows that if you get an agreement on that, first of all, right, that they have a pattern of passivity and compliance and people pleasing, and that they tend to get used and abused by others. So once that's identified as a problem that they want to work on, then keeping your eye out for the way that they're actually inviting you to repeat that pattern, that you point that out to them, and also make it clear that you're not going to participate in that kind of unhealthy way of relating, and that you're actually offering them a healthy alternative. Okay, so that's again what we might call the transference pattern of behavior. It's a manifestation of the patient's character defenses, their typical way of being with people that, again, pull for the very thing they end up complaining about. So this is vital that you catch it and turn it around rather than repeat the old dysfunctional way of relating. The other thing to keep your eye out for is feelings coming up in the transference. So again, the first thing I'm talking about is really sort of a defensive pattern of relating that you have to catch and highlight and turn around. And the other is to keep your eye out for any indication that the patient is having feelings toward you that they're anxious about and avoiding. So being able to inquire about, it looks like you're having some feelings toward me, right? Do you see how just as we go to talk about, you know, your anger or sexual feelings or whatever it is, you shut down and withdraw. right? So I wonder what kinds of feelings you're having here toward me. Again, to make these interventions effective, you do have to have some data to suggest that they're actually having feelings towards you. You don't want to just, ask that question randomly, but you will note, that they're making a face or, have a tone in their voice. This often comes up around defense work when you're pointing out to the person, right, how defenses are operating in their life when they're talking about current problems. And they might say, yeah, I see it, okay. And obviously the tone of their voice is indicating, you say, okay, so you see it, but it looks like you're having some feelings toward me for pointing that out. Are you aware of that? And should we have a look at it? Because any feelings that they're having but avoiding are going to become a barrier. They're going to become a brick in the wall between the two of you. Also, when you do get feelings coming up in the transference, and in ISTDP, we don't interpret that. We actually invite the feelings to come out directly toward us. So you have an anger toward me, right? And how do you feel that inside? And as they get mobilized and you notice fists coming up or jaw clenching or kicking of the feet, right? You're going to watch for that impulse coming up to the surface. And that's when you can begin to go to what we call the portrait. They're sufficiently mobilized, that impulse is getting activated, and then you can ask, yeah, you're really angry. Do you notice those fists coming up? So if that anger came out toward me, what do those fists want to do? And this is what Dav and Lou found was really the key to opening up the unconscious, is that when I just had a great example of this a couple weeks ago with a patient, even though it was subtle, but there were subtle ways that he would avoid my eyes when we got to a tender topic. And so I pointed that out and again wondered what he was feeling toward me. And actually, he experienced quite a massive rage toward me with this impulse to just punch me, in the face and in the eyes. And I got black and blue. And then when he saw that, suddenly there was a transfer of images to his mother, who had died of a liver disease and looked kind of black when he went to see her. So this is really the fastest, most effective way to get that breakthrough into the unconscious. And when it does come through the transference, it seems as if it provides a much broader opening into the unconscious and those links to who you represent and to the unconscious conflicts that are responsible for the patient's suffering come to the surface in a really unmistakable way. So this is going to power up your work. You do not want to avoid or neglect what is happening in the relationship with you. Again, pointing out the defenses in operation, the tactical defenses, the way the person's keeping you at arm's length and avoiding really intimate relating, and also picking up that they're actually having feelings toward you, and they have a choice. They can look at them to get help with it, or they can avoid it and then undermine the treatment. So I hope this is an important reminder that one of our most powerful tools is to work with the here and now, what's actually happening between you and the patient, and to connect that pattern to the pattern of difficulties that they have articulated is going on in their life. And being able to do this not only creates this wide opening into the unconscious, but presents a unique opportunity to facilitate a truly corrective emotional experience with you. And that's what I'm going to talk to you about the next time. So thanks for listening. Please send me your comments and questions. I love hearing from you. Bye-bye.